Okay, mashallah, we have quite a few participants. So I'm excited, and alhamdulillah, it's good that we have a lot of people who want to know about depression and anxiety. And I am to start off with giving my own background. I'd like to let everybody know that I am a family practitioner. So I have done my training in family medicine and specialized in the field of geriatrics, which is for the elderly, and currently practice for the seniors and adult medicine in an outpatient setting. And in the past 5.5 years, I have got the opportunity to serve in a clinic in Georgetown and see a lot of mental illnesses and a lot of just what we call different presentations of depression and anxiety. And that's what I'd like to bring attention of everybody to. So I hope everybody can see my screen that I am sharing. If you have a laptop or a computer. So we all know there's a lot of awareness now and talks about depression and anxiety in the youth and middle age, as well as in the elderly. And there is, mashallah, a lot of awareness amongst the community now. But how does this look like? How does depression feel like in a day-to-day basis? You have some symptoms which we call are related to your mood, and there are others which are actually the way your body is reacting to the mood that you are in, and it is trying to tell you or signal you in a way to explain that this is something is not right. So there has to be a balance, but to have a good physical health we have to also have a good mental state of health. And where is that connection? How do we see that as a presentation which is different than just the mood symptoms? So, most commonly, what we call depression is when you have these symptoms, at least for a period of 2 weeks. If you have any of these, or more than five of these, then certainly you could be having depression. Not necessarily you have only depression. There are a lot of other things we'll talk about later that can or need to be ruled out. But definitely, the mood symptoms include a feeling of sadness where you are just feeling down or having a low mood and just do not feel like you want to talk to anybody. You want to be left alone, or have this hopeless feeling like there is no reason for you to be, you know, here. There is nothing that can change. Everything is just looking glim, and things are just not working your way. You don't have any hope for things getting better. There is so much of darkness that you do not see any bright light anywhere. All you can think about in anything that happens is how this is wrong, how this could go wrong, how things could just be happening wrong every time, instead of just having that hope that after every that difficulty, the ease is going to be there, the good things are going to happen, good, and just good things to happen. Rather, you also cannot see the good that is happening right now. You feel very empty within. Yourself is just not content with your surroundings. It's just, or you're just tearful, and sometimes you don't even know why. You just want to cry or just have a moment where somebody just said something to you, for instance. And it happens to all of us. It could be, these things do happen, but what I am trying to say here is this is consistent, this is persistent. Like, if somebody just told you, hey, you just, why did you do this, and the next thing you know is there are tears rolling down your eyes, and everything that somebody's telling or happening to you, it just makes you cry. Or there are even people who say, I don't know why I'm crying so much, but I'm just crying. And you just notice yourself is just crying every single day without even having a good reason to cry sometimes, and very, very irritable. Like you do not want people to talk, can't tolerate sounds around you, you're just like wanting to be quiet and left alone, and anything that happens you want to snap at people right away, you get angry easily. Every certain thing makes you mad. That is the irritability, and that is also could be a sign of depression. Now the other common mood symptom is, so there is no interest or pleasure in doing things, like somebody who is working. For instance, I go to work every day, and there are days when we all feel like Monday morning blues. We don't want to go to work. We are like tired. That's a different thing. But having it once in a while, but every single day, if you do not feel like you want to get out of bed and do anything, you have no interest or pleasure, all you do is just sit in a place or just spend your time just doing something that is not productive, you're just sitting and not trying to do things which were of interest to you. Like your work was good, you wanted to work and you are happy, and then suddenly you do not like to do that. Or people who have hobbies, like a lot of us, we just like to exercise, walk, someone likes to cook, someone likes to clean their house, like organized. People who are they like gardening, they like, or even socializing, going out and meeting others, having just throwing out parties, for instance. Anything that was making you happy before, you have just not no had no interest in it. Or your friends are like, where are you these days? You're just not out, you're just not coming out and talking as much. Your family notices that you're in a room by yourself, you just cannot come out and do anything. That that loss of interest or pleasure could be a sign of depression, that your mood is not where it needs to be. You're feeling guilty of everything, or you're just worthless every time, that all you can think is, I why am I here? I'm of no good to anybody. I'm not doing anything right. Or everything that I do is wrong. My family people just don't hate me. They just don't like me, what I do, or nothing's right. Everything is going wrong. And I have no self-worth, just low self-esteem. That can be a big thing. Your lack of concentration or focus. So if somebody's trying to learn something, you have an exam, or you're trying to do a course or trying to understand something, but somebody's just talking to you, or you're listening to something, but at the end of the day you got nothing out of it, you were not focused at it at all, then that could be also a sign of depression. Not necessarily you have any other mental illness, you're just too much, is your mood is just not there, you're not in the right setting of your mind where you need to get that information and where your mind can process it. You either lose weight just because people are not hungry, they just don't feel like eating, they want to just have no interest in eating at all. Or on the other hand, a lot of us don't realize when we're eating too much. And you hear this very commonly. When I'm stressed out, I binge. I eat sweets, I eat sugar, I eat things I do not like to eat normally. But you're just eating. You're just trying to satisfy something within you, and you're just trying to stuff food in your and just get that feeling of being happy. But that doesn't come, unfortunately. So, um, oh, I think we lost my presentation. Hello? Okay. Can everybody, I think you can still see my screen. If you cannot, just put in the chat somebody, and I will go ahead and see what we can do. But I'm going to go ahead and continue in the interest of time. So we were talking about the weight and just eating and uncontrollably eating. Then the other very important aspect is sleeping. You absolutely cannot sleep. When you're trying to sleep, all you think is your mind is running. And I heard this very commonly in my practice, that my mind does not want to stop. My mind is constantly running. And I have just not been able to sleep because I'm constantly thinking of something. That is another thing. that commonly happens. But the another thing that we do not notice, but we do hear a lot in practice, is we're just sleeping too much. We just do not want to do anything. All you want to do is sleep through the day. You got up, you had your, got ready to start a day, and then after a while you just feel exhausted and you want to just sleep again. And this is not how you were, or this is not how you want to be, but that's how you always feel. You're just tired, you're just not able to move or do anything. I can hear some things, but I don't think that anybody is, I don't see any chat here. Okay. So there are sleep issues which are very common with this. There is too much movement. That means your body is just moving too much, or you are just too little of a movement. Like when I say too much movement, it is like you're shaking, you're constantly on the go, your legs are shaking, your hands just want to fidget with something constantly, or there is too little movement, like you're extremely slow and somebody's like, what's wrong? Why are you not able to finish this work? What is happening? And that can be a sign of just feeling low and feeling depressed. And the most common thing is feeling tired, feeling just exhausted through the day, having no energy absolutely. That is a big problem that we very commonly here in primary care. That is one thing that we are evaluating and evaluating. We are doing labs, we're doing multiple things, and we talk about what needs to be ruled out, which is very important. We do not want to neglect that. And at the same time, we want to be sure that we're not dealing with any sort of low mood or depression symptoms. But another very important thing is nothing should be neglected in this aspect is thoughts of dying. And that could be as simple as a feeling like it would be better off if I was dead right now. Very commonly, I hear this and people neglect this thought of and they don't want to express this because they feel like this is just not right to express that they've been having these thoughts. But you will be very surprised how many people do we see in primary care. And currently, per some statistics, it shows like almost 30% of the population will have some symptoms of depression or the other. And a lot of that population will have these feelings of just not necessarily you want to do something about it, but you have been constantly having this feeling of, I wish I was just not here, or I wish this was, there was something, I would just be gone right now. And that is actually a suicidal ideation, not necessarily you want to act on it. Now, that is a different aspect. When somebody has a plan to act on it, or they feel, okay, I am going to do this, so I am gone, it is that is much more serious. But just the thought of it also is very serious. So you really need to talk to somebody about it, and that needs to be addressed. The most important thing I do want to bring to attention is what majority of the people present as, especially as a primary doctor. What do I see every day? I see people, two-thirds of my people who have depression actually do not come to me saying, hey, I am depressed, help me. They come to me with these problems. They come with headaches. And this looks like an everyday headache every single day, or maybe over the weekdays, or when a time when they are extremely having these environmental factors which cause them to feel low. Then you have these problems of having a headache almost every evening, mostly, and it will be all in the front as well as the back of your head. You feel like a tension, like a band on your head, including some tension in your neck. This is because our body is creating that tension in the muscles, which is causing us to feel the pain in a way that it is triggering the pain receptors, and it is telling you that you are not taking care of it, or you're not feeling well, and it really wants you to take care of the mental state. And one of the things is, a lot of times these will get better when the stressor or the problem goes away, or when they are out doing something, or they are exercising, the days which are much more happier mood, they've been doing the right things, they feel much more happier, the headaches don't come. But almost every time when there is a stress or a factor that leads to it, then you have these presentations of headache. And people who already suffer from blood pressure issues or diabetes, their pressure, their sugar is uncontrolled. Diabetes, as much as we want to, have take care of it, it is a problem that can escalate because of stress and your mood and depression. And the other thing that happens is we see people not taking their medicines or feeling just so bad that one of the way that they want to just feel like they want to go away is not do anything for themselves. So they don't want to take their medications, don't want to take their insulin if they're on it, just do not want to do anything, not even visit the doctor. So okay, I have somebody who has raised her hand, and I'm gonna go ahead and let you talk so I can know what's going on. Go ahead, Zainab. I have asked you to unmute, Zainab. If you're listening to me, you can go ahead and talk now. Okay, I think she did not want to talk right now, so we'll continue. And pain is another very common problem that we do see. You will be having a lot of back pain. Women especially have pelvic pain or pain and their during their periods are worse, pain in between. And to the surprise, you have stomach pain, abdominal pain, where you have cramping and a lot of other problems with your digestion, and you're just not able to have a good digestive system and a good bowel movement. And again, as I mentioned, feeling fatigued, feeling tired, feeling just down every time, that is another very common thing. So a lot of times there are other medical conditions that you really need to look at. So one thing is visit your doctor, talk to them about it. If you've been feeling tired, if you've been feeling low, you've been feeling down, when you talk, you have to first make sure that you get these medical issues ruled out. So request them or ask them to see if you can rule out anemia. Very common to see this, especially with our lifestyle and our diet that is different. You can see people who have very low hemoglobin, they're anemic, and that's treating this can lead to resolution of a lot of your symptoms. Thyroid is another very big factor. When your thyroid is low, you can experience a lot of these symptoms, just feeling down, not being able to do anything, just feeling low and not carrying out your routine activities, gaining weight, eating differently. Thyroid is associated with, you name it, and it is associated with a lot of problems. So um, that can be another big issue. Then seizures, people who suffer from seizure disorder, they have certain actually structural problems in the brain which could lead to feeling depressed, depending on which part of the brain they have their focus of the seizures. They can be feeling low. There is a Parkinson's disease, which is starts very commonly in the older ages. You see people having tremors and their faces are very blank. They have no expressions. They're very slow. So if that is the starting of Parkinson's disease, then that would need an evaluation. A thorough examination will lead to some conclusion about if there is any other problem or whether this is um, an issue. But these things are something that we look at first before calling anybody, before saying that you're just depressed. I would do these. I would get a blood work. I would check what is going on. If everything is normal, then we say, hey, things are normal. Everything here looks okay. But what do you think? What you eat on a daily basis? Do you take any multivitamins? Specifically, there is a lot of relation of vitamin D deficiency, vitamin B12 deficiency, folic acid deficiency, which is related to your brain and how you feel. And in general, a lot of other also vitamins, but these are the big ones. And we do not necessarily test for vitamin D every time somebody comes in the clinic. So you may have to sometimes request it to your doctor and say, hey, could you please check and see? And once you have completed, they will give you some prescriptions to take or an over the counter vitamin. But however, take this every day because whatever research we see that whenever we replace the vitamins, a lot of the symptoms do improve. So that is another very important thing to do. And sleep apnea, if you haven't heard of this, very common very common to see now, but how does that look like? It is you are not able to sleep a good night's sleep. People snore, wake up feeling like they're out of air. It is more common in people whose weight is more than the recommended weight in the obese population. You are more likely to see it because what happens is when you're trying to sleep, the entire airway is pushing against your neck and the throat, and you're not able to breathe well through the night. And when you're not able to breathe, your brain signals and wakes you up because your brain is, subhanAllah, Allah subhanahu wa ta'ala has created it in a way that it is the most precise. It has mechanisms for everything. So when your oxygen goes down or you're not breathing, it gets a signal to wake you up to breathe. And you're going to feel like you were out of air or somebody was choking you, and you get up and you start gasping and getting the air in. And that is when this is a very common presentation. Now, the good part is it's a very simple test. Your doctor can give you a machine or they can order a test for you at home, and you can get that test done in your house where they can look at your oxygen in the night, how many times it drops. If it does drop, they will give you a machine to sleep on. And that will help a lot of times the sleep apnea. And when that is treated, you feel I've had people just tell me, I feel day and night difference. It is a very, it's a small machine now, but it is not the most convenient thing to wear at night. But the benefits of it are tremendous. That you see them, they're like, I'm a different person. I'm able to focus. I'm able to do my work. I'm able to do everything correct. Why was I not, doing this before? And that is very reassuring, that sleep. And there are other things to treat it. And personally, I've had people try it. Some people say they benefit from it because, when they sleep on recliners, they feel better. When they use the nasal strips, or especially when it is your upper airway system and you're, not able to breathe because of that, and you're just constantly having sinus issues or not breathing well at night, then you use the nose strips or even the chin lifting strap, which is there. And they're able to breathe better at night. And when they sleep better and they're breathing better at nighttime, they feel much more focused and energetic the next day, which is amazing because you're able to treat these things with simple fixes. So these things have to be done before. So talk to your doctor about this, and make sure that this step is done, this is ruled out. And then after this, also look at your medicine bottles. Are you on any beta blockers, something that was done for heart or a heart problem, or what we call the coronary artery disease, or somebody who's had a heart attack or high heart rate, they'll be on these medications called beta blockers. And when we start them, people start feeling very down. They show signs of just feeling depressed, not wanting to do anything, wanting to sleep all time. They are just they're just not feeling themselves, and it could be the medicine doing it. In your medicine doses could be decreased, you could be switched on to other medications which can help to lower heart rate. If your problems are so significant that your functioning is affected, just go ahead and talk to your doctors about it. The cholesterol medications, we see a lot of other people who have heart problems also on these medications because they're called statins, and they are associated with depression and depressed mood. Steroids can do that. People take them for breathing troubles, for a lot of other reasons, where they want to suppress their immune system. And that's when the steroids also play a big role in it. A lot of hormonal supplements, which include the birth control pills, they could be used to regulate your cycles, or just not necessarily the steroids, which are for your fitness and bodybuilding, but the pills which are used in females, especially for birth control as well as to regulate the periods, can be a cause of of mood symptoms. And just in general, people who have some hormonal disorder or going through menopause towards their midlife, in their 50s, they can be experiencing a lot of these symptoms. So a lot of menopausal women do feel a lot of irritability. They're crying more, they tend to gain weight, they're eating differently, they feel their habits just suddenly changed, and that could be that you're going through that. So that has to be another thing to be addressed. Pain medications. Now, this is something that was used before. A few.
So for those of you who couldn't hear,
But now we find that they are, and specifically the ones which are opiate medications, those are the ones that are linked with depression and even with dementia later on in life. So that is very common to note. So if somebody's been on them for a long time, Sorry, I lost my video, and I think I lost the audio also for a bit, but I apologize for that. I'm having some difficulty at my Zoom end, but inshallah, I will. If you guys are still there, I would just continue with the other part of my presentation, which was about anxiety, which is another very common disorder, which is we we see this very commonly. We talk about it very commonly. We do talk about to everybody. I'm just feeling anxious right now. I just don't know. There's just this feeling which is worried feeling, which I'm absolutely not able to get off. And the most common thing that people come up with is I'm worried all the time. I'm worried about everything going wrong. I'm worried about the slightest bit, like to step out of the house. I feel like something's going to happen. And then the news these days doesn't help you. The things that happen around you does not help you, because there is so much happening around you that you absolutely do not know how to react to it, process it, and um, be okay with what is around you and take care of what you need to take care of. So you're worried about all of those things around you, and at the same time, this worry can lead to a lot within your body, and it can lead to things that you feel all the time, and you just don't notice that it is your worry or anxiety, as we call it, leading to this. So most commonly, very commonly, we see people who are going to the emergency room. They're going to the emergency room almost like few times in a month, or even more than that, visiting doctors every few weeks or every week. Sometimes just they're coming and they're like, my I have chest pain. This is the most common thing. They have chest pain, young, from the 20s to the 50s, and most commonly in the younger people. I want to say in the second decade of life, in the 20s, and they come with this pain which is in the center of their chest, and it just feels like something is there, like a feeling of impending doom, as we call it, like something's going to be wrong, and the pain is there. It just sometimes remains for a long time. It doesn't go away with anything you do. And then once you go to the hospital, or they give you any medications, the doctor tries to just calm you, reassure you your pain is gone. But mind you, the chest pain is a very common presentation of anxiety, but at the same time, a presentation where you need to go to the hospital and make sure the heart conditions are ruled out. Once the heart is ruled out and you have a assurance that your heart is fine, there is no problem with your heart, why do you experience this pain every time? It could be because of anxiety. And that is something that you need to sit, think, and talk to your doctors how to treat this and what to go the next step. Your blood pressure starts to go up, and you notice that it is not up every time, because when we ask somebody to take a record of their blood pressure, they will say it is fine most of the times in the house, but when I come to the doctor it is high, or when there is a certain situation it gets very high. So the stress or the worry feeling that is within you, it it triggers your sympathetic nervous system. It triggers it in a way that it raises your blood pressure. It causes the heart to race. It causes symptoms of tingling and numbness in your hands. Your hands are shaking. Your mouth is feeling numb and tingly, especially in a case where there is a panic attack. And panic attack, mind you, is a very later, it's a very severe presentation of the anxiety, and it could be happening very commonly that you have something to do, or you have to just a simple thing like going out, or if somebody's had an accident, for instance, and they want to drive again, when they get onto the wheel, they're scared, or they're in that particular situation, they panic out, they're not able to think, and your brain just stops thinking rationally at that time. And it is sending all these triggers everywhere to just asking for help. It is nothing but a way of telling yourself that you need to help yourself differently. And the other thing is, when we very commonly, we've heard everybody say that gut feeling that you have, that my gut tells me this is not right. My gut feeling is this is something's wrong here. So that gut feeling is always existed. There is a lot of study now that tells you that what your intestines, your gut is related to your mood and how you feel mentally. So when you're, for instance, eating a very good diet and you're feeling very good, your bowels are moving regularly, you're feeling absolutely fine. But when your mood is down, you have either constipation, or when you're very anxious, you have diarrhea. You can have pretty much like diarrhea or cramping, and then you just use the toilet and then you feel a little bit better. And that is what we call an irritable bowel. The bowel is very sensitive. It is reacting to that mood, the hormonal changes within your body, the neurotransmitters that are going up and down. It is reacting to that and causing that symptom. And a lot of times the treatment that even the specialist, and we refer these people to the specialist, make sure everything is fine. We do tests to make sure the sonograms are normal, everything is normal, the stool test is okay, but still you're having this pain in your abdomen, you're having diarrhea or constipation, something is happening, and this is for real happening. It is not something that you're making up. Your body is actually showing these symptoms. You have not made this up. And there is a feeling of nausea, or you're having severe heartburn, where you are feeling this acidity, as we call it, all the time. No matter if you eat, if you don't eat, you will have a lot of burning in your heart, and you want to not eat and still it doesn't go away. You want to eat something different and still it doesn't go away. And the diet we eat, like normally when we are, the Indo-Pak diet is thankfully full of spicy food and greasy food, which does not help it either. So that is something that happens too. The one thing I want to also see is, why do we not talk about this? Why do people, so if you have diabetes, if you have high blood pressure, if you have heart problem, yes, you have a problem. You tell your friend, okay, the doctor told me I have diabetes, I need to start taking medicine and I'll start feeling better. Or I have this issue and I just they diagnosed me with this condition or that condition. But when we are feeling down or low, or when we are feeling anxious or nervous, or we are having a panic attack, or we are actually having any kind of mental illness for that matter, we do not want to talk about it, because we think that that is just not an illness. That was never um, a medical problem. That was never an issue of where you could treat it, where they could do different things. But it has been there. It has been existed for ages. In either it was underdiagnosed before, or now we are more aware of it and we want to take the stigma away. But this does, mental illnesses exist. We do feel these symptoms and we need to talk about them more. And depression is not just for a psychiatrist. You can just go talk to your doctor. If you have any regular doctors, you can just talk to them about it and say, hey, I I may be having this, I may be having something else. I want you to help me here. All we want is that one thing. And there is a question paper that your doctor will give you every time. We do that in our clinics, and it is one of the requirements to screen everybody who comes to your clinic with a questionnaire called health questionnaire, a patient health questionnaire. It has 9 questions. All of them are exactly what the symptoms we talked about before. And they will ask you to mark from a scale of 1, 0, 1 to 3, where your symptoms are either never, they're sometimes, every time, or almost like every single day. So you mark those answers on that. One thing I do see is a lot of people just ignore that paper, or just look at it and be like, oh, this is for depression, I'll mark all zeros because I'm not depressed. But read those very commonly. And if you feel like you want to mark what you feel, do not just try to do it differently. It could be that you've had a flu or you've had COVID recently, and you've had you just had low energy and you were not feeling okay, and that is why it is positive. Not necessarily you were depressed, but just be honest with that. In that case, what can happen is your doctor will call you back again in a month or 2 months, and they will make sure that that is now better. If it is not better, then they can do something about it. And it is a real illness. Yes, there is no test to say, like, okay, your sugar was 180 today, it was 300 before. Wow, you did great. Now you're at 180, 150. I want you to be at 100. No, that is, we don't have that. We don't have that. But we have functional MRIs. We have looked at the brain imaging of the people who are depressed. There are certain things that are found, but that is not at a level where we can diagnose every patient with MRIs or check some neurochemical levels and say, hey, this is how depressed you are. And if you take these medications, then you will feel better. But there is one thing, some private practice people, practitioners use that, and that is called pharmacogenetics, where when they prescribe medications, when they go to medications, they will run a test and see if that medicine will work for you or not. It may be something you want to talk to your doctors or even the psychiatrists or the people who might be doing that. And that is something you want to talk to them about and see, instead of just trying a bunch of things. You may want to go to that and see. People are worried about their confidentiality, whether this information is going to go to somebody. Is my family going to know that? Are people? How are people going to think about me if they find out this is happening? But when you go to your doctor, we are bound by a confidentiality um, contract with our patients. It should and it does not happen that we, even if it is my own family member, not my own family member, but somebody very close to me or whoever it is, we would not talk about anything to anybody. We are bound by HIPAA, and that is something that, your information is confidential. Don't worry. Your school, your job, your work, anybody is not going to know about that. You're not in trouble anywhere. You're not going to disclose this to any government agency, anybody, that, hey, this is, unless your permission is given, your information is not disclosed. People are also, there is a very big concern that especially parents who have children and they are diagnosed with this, how will the family react? How will things around them be? Because they would, a lot of times when there is between marriages, or when marriages are when parents are divorced or something like that, when they want to make sure that they don't talk about this, so they have the custody of children or anything like that, there could be issues like that. But this information is highly confidential. It's our liability to keep it that way. So talk about it. That will actually help you. It will change a lot in your life. You will not only just be living better and more productive, but also you will be better in every aspect, whether it is spiritual aspect, whether it is your functioning, whether it is your work, whether it is the achievements that you want to do, the person you want it to be. And that is that it's very important to talk about it. This is, if nothing else you want to take from this today, the most important thing I want you to understand is talk about how you feel. Talk about your mood. If you are low, you are happy, you are sad. We did not, a lot of the people who might be in their 40s or 50s, or even immigrants, depending on where you came from, what culture you were raised in, how you do not want to talk about your feelings a lot of times. And talking about your feelings is okay. Encourage the same within your household, your own children, your spouses, that, hey, I do not feel like that, and that is okay. Empathize with that person, that it's okay to feel that way. Validate their feelings. Like, how are you feeling sad? Why are you feeling sad? You have everything. This is very common in the people, and patients actually in our practice, they come with this, that I don't know why I feel like that. I have everything. I have a wonderful life. I have everything that I would have hoped for, but still I feel that empty feeling. I'm sad. And it's okay to feel that way. There could be something wrong, not necessarily that you have a problem, but we need to look at that. If it's medical, if it is something else, why are you feeling like that? And then you can seek help. and they have a lot of concerns with antidepressants, medications which we use to treat depression, and being addicted to the medications. People have, every time I want to prescribe something, it's like, oh, give me something very small. Sure, give me something that I don't get hooked onto. Absolutely. This is not, we base our evaluations and our treatments based on how you feel. What works for you, what doesn't work for you. They're worried about side effects. Don't worry, just go back, talk to your doctors. It may take time because as I said, there's no particular blood work to, understand and treat this, but the medications work. They do work. And I have seen, it is very, very reassuring when you see in your own practice that somebody who was absolutely, one day in pain, having so many problems, just to the extent, I just want to share something, and this is not with any information, but somebody who had come with very bad ulcers on their legs, like to the extent that you could look at it and be like, this could only happen in a third world country where you had no care. But the person ignored themselves, ignored their pain, ignored everything that they could see, actually, like bleeding on pain and everything they could see, for a time, until somebody just forced them to come and see a doctor. When initially somebody saw them, it was so severe, they had to go to the hospital. They were discharged from the hospital after a month or 2 months. Everything was taken care of. I saw them back again and I was like, okay, so you're feeling better, but this is improving. But one thing would not improve is diarrhea would not go away, because they were in the hospital, they'd got so many antibiotics, and they would not move, absolutely not move. Got to a wheelchair. But after a couple of visits, actually, after having a relationship with the patient, and because I was the primary care then, and they decided to come back, follow up with me. One day I just brought it up and said, hey, what do you think about your mood? Like, how are you? Why do you think you're not participating in therapy, doing anything, walking? What do you feel about that? And they said, we don't know. Never thought about it. I think I'm okay. But after an evaluation, questioning more, is like, I do feel that this everything that you've been suffering from could be coming in just because you are depressed or your mood has been sad. And to the extent at that time, confronting the person made him feel like it had opened like a light bulb, like, yeah, it could be. But at the same time, they were still not very, convinced that, okay, what do you want to do next? I said, okay, I want to help you out. I want to start medicines and I want you to go see somebody. And when they agreed to do that, when they saw somebody and they started medications, mind you, very small doses of medications, but and your doctors will work with you. You want to, whether you need more, you need less, whatever you want to do. And that person participated in therapy, took care of everything that they had come after about 6 months to my clinic, walking without that wheelchair, using just a single cane, and said, I'm walking everywhere now. And everything that they would, if there was a new problem, they would make an appointment, make sure their blood pressure was controlled, make sure they saw every specialist they had to. And they were taking that time to care for themselves. Just with that change, it just confirms that these things happen and how much we can help people around us, by treating them. So do not ignore that. Go talk to your doctors about it, and they can help you in not just one way, but in many other ways. I still have a few minutes, I think, and I'm going to talk a little bit about how you can go and visit therapist. So how you can see somebody for the help that you need and what they can offer you. So when you see a therapist, they have multiple ways of helping you. They can give you they listen to you. They will give you some ways to work on these feelings, how you can better process these feelings, what we call cognitive behavioral therapy, where you and many other methods of therapy. And we have very good therapists who are in our community here, and they come and talk to you also. So they will elaborate more, but they will just talk to you for sessions and make sure that you're able to process these better and help you improve that mood and anxiety that you have, along with the medications if you need them. Not all the time. If you have a milder problem, you may not need medicines at all. But if you have somewhere between a moderate to a severe depression, you may need medications. How long you will need medications? That is something. Oh, somebody said nothing is being shared. I have just finished my slides, so I'm so sorry that after the video got lost, nothing was being shared. But I'm gonna see, is the probably the video should be coming back on. Okay. So one other thing is when you go seek help or see a counselor or a therapist, they will let you do things to process this better and see how you will need help, especially when you're feeling low and you're having feelings where you were better off just gone, or something that why you were just not wanting to live, not wanting to do anything. And that is just a feeling that nobody wants to get. Everyone wants to be in that happy mode and feel better and be more productive through their days. And that really, really helps. Keeping a log of, talking to somebody, keeping a journal is another thing that helps. Writing about your feelings. It doesn't matter what you're writing there, just write it out and look at it later, or talk to the therapist about it later. It works. It does help a lot. Some non-conventional things that help, and I use that in practice a lot of times. And I tell my people that one is better than zero. So any movement is better than no movement. Because when somebody tells you you need to lose weight or 50 pounds, that's just too much. How will I get there? I don't want you to lose 50 pounds, is what I tell people. I want you to lose 1 pound. 1 pound in the next 2 weeks, or whatever amount you're going to come back and see me. And they're like, oh, that's it? Yeah, that's it. That's all I want you to do. Just do this and come back. I had a very interesting book that I had read, and I do share it with a lot of, I use that in practice a lot. It was Tiny Habits. It was when you use small things to achieve your goal, but your habits start very tiny. It does link a lot of your habits to your emotions. So it tells you an entire process of how you can build your good habits and get change your bad not necessarily bad, but habits that you don't like, habits that you would like to get rid of, but in a very systematic fashion where you feel happy about living every day. And in that, if any of you have a chance to listen to it, or get a chance to read it, it is called Tiny Habits by BJ Fogg. It is from a Stanford researcher who is a PhD and has researched a lot about habit forming and actually looking at treatment of depression without medications, without with just these therapy and habit changing patterns. And that really helps, because if you want people to the other thing that helps your mood is exercise. And just with somebody who's extremely depressed, do not want to walk, do not want to exercise, don't want to go out, don't want to do anything. But one thing you can start off with is just wearing your walking shoes every day. It sounds silly, but it is something that I read about, and I have given this advice to my patients and been very successful. It was like, they're like, are you just mad? What, just wearing walking shoes and do what with it? I said, nothing, just wear your walking shoes and feel happy about it. They're like, 9 out of 10 times, if they wear a walking shoe, um, they will go out and walk. They will go and do what they needed to do. So you start off tiny, you look at a small thing and then build up on it. And then somebody just asked, what about giving back and volunteering? That really, really helps elevate your mood as well as feel better, because you do find the purpose, you find reason, you see that pleasure of helping people. But if you are so far beyond in the depression spectrum, where you are having an extreme fatigue, where you're not able to go do that, what you see is you may go do it one time, but you don't feel like doing it again, or have you're not consistent with it, you're not able to do it, and that may just be preventing you from doing it. So seeking the help to take care of that first, and then trying to do things is very good. Helping others is definitely a way to feel better, to feel more elevated throughout your life. And but also another thing is self-care, which is very, very big, which we do not talk about, um, which we don't talk about a lot, is taking care of yourself. And that is important. Take some time every day. It doesn't matter what it is, just it could be just taking time for yourself to take care and feel happy about that. Meditation is absolutely, absolutely, especially for anxiety. Meditation is a way, and deep breathing is a way to treat the panic attack or or a severe anxiety symptom. People who do this consistently every day, not necessarily you have to do it on your own. Find some help, join a class, find a friend who can help you, who's learned this. And Alhamdulillah, in our deen, we have that 5 times a day. We have meditation. But when you're struggling with that part, then you're not feeling happy. So make sure that if you feel too down, you talk to your doctors about it and see if you can get help. But meditation is the best way you can connect with your own feelings and see what makes you feel better, and feel that anxiety goes going away. And as I said, exercise and food. Food is a big, big, big thing, as much as we think, which can help us with our mood changes. So we do read a lot these days about the sugar and the processed foods, and you have to understand that that impacts your mood in a very negative way. When you're eating too much of processed foods, when you're eating too much sugar, it does make you feel better, maybe temporarily, because you feel that high, you feel that rush, the dopamine is at a good level, and then after that you just crash. You just feel like you're feeling extremely sad. Sometimes people feel guilty, especially because when they're trying to lose weight, but all they did was they ate when they were not supposed to eat. That just makes them feel more bad. So that the food does play an important role. One thing that is important is, if you are a person who cannot control the eating habits, one thing you can do is control the environment around you. So do not bring anything like that. When you see that something, how we can get rid of a sugar habit. Okay, I will come to that in a little bit. So when you feel like you want to just binge, all you will have is probably carrots and celery and cucumbers, and you will have something that is, maybe good nuts, um, something that will not make you feel guilty. Even if you ate a bag of it, not like a bag of chips, but instead a bag of, you just ate some. You can't eat a bag of nuts, trust me, it will be too much, and once you feel a little bit, you will just want to throw up. So the next time you will buy it yourself, not go eat so much. And then it's going to make you feel very satisfied also, because it has a high fat content. It is a big part of the keto. So the fat content is going to give you a satiety for a very long time, and you're going to feel happy about that. So snack on, keep things that you think would is what you want to eat, that is low in sugar, not processed. Try to get frozen stuff which you can make easily at the house. We don't have the time sometimes, so we want to buy things from outside. But this, you want to go ahead and get things which are quick and easy to make. Remember simple things, simplify the things around you. When you simplify things, you find it easier to do it. And that is one of the ways. Somebody asked, how do you get rid of your sugar habit? When you are depressed, it is hard to get rid of, eating too much sugar. But when you start, if, as I said, if you're a person who does not, don't keep anything sweet around you. Absolutely do not have, tell people in your household, hey, listen, I am trying to do this and this is for the good for everybody. So as a family, we are going to get things which are low in sugar, or we are going to just eliminate this completely. Now, if you have a can of sugar in the house and you're just going to go eat that, then that is a different story. Maybe you should just stop buying that. Instead, just substitute it with like monk fruit or agave or something that is low glycemic index, but it can, take care of the sugar, because it will make your food sweeter. But at the same time, because they do not make your sugar go up so suddenly, it is okay. Your mood will still remain stable and you will not feel that high and low suddenly in your mood. So try that if you want to, use monk fruit extract or agave or stevia, the natural forms of sugar. They are better than using the artificial, the processed sugar that we have. And that is, if you like chocolate, go for a dark chocolate. Don't go for something that is, extremely sweet. Go for dark chocolates. There are actually benefits to dark chocolate. They will enhance your mood, and at the same time you can, fill your sugar high that you have. And you may one day eat a bar, and then next time you'll see, okay, half a bar is fine too with you. But one thing is, the expectations also. Do not think you're going to lose 20 pounds in this 1 month. Keep your expectations realistic and seek help. Meditate, exercise, start small, and celebrate your small wins also. Because one of the things you want to do is consistently, when you start small, so somebody who's eating sugar after every meal, and you're a person who's a dessert person, as you call. I have a sweet tooth, and who doesn't? Like, I have a sweet tooth. I had a sweet tooth as a child. I've always, and I never thought about it as something wrong until, when you start noticing, oh, I don't think the sugar is all because I just love it so much. It's probably something else underlying that is causing me to go to that sugar. And so just look at that and see what is the feeling that you're in when you're wanting to crave that sugar rush. And how does that sugar help you with that? And even talking to the therapist can help you, because now I have some people, especially with diabetics, when we do this, because they commonly go through this up and down. And when they talk about it and they learn the habits correctly, they are able to take care of their sugar problem. And a lot of times there is something deep underlying. So there are people who, there are studies that show that people who've gone through trauma or had some bad experiences, had something that was not processed correctly, they are now just taking the sugar as a way to help them. And that is not the most appropriate way. And again, go for natural foods, natural sugar as much as you can, because you can process that better than the artificial, because that is the processed sugar is what's going to cause the problem for most part. And foods in general which are processed, the breads, the um, any and everything outside, the cakes, the pastries, you name it, and everything is not the best thing for you. Once in a while you want to treat yourself, then that's a good thing. But if if you just are a person who does this every single day, then there is something underlying. Just seek some help, maybe few sessions of therapy, somebody to talk to, or not necessarily even a therapist. Somebody who's doing well can even go to a life coach, or just have somebody follow up on you, make sure you are able to see what you're able, where you are on this, and treat your problems. I have somebody who has raised a hand to talk, and have unmuted the person. Do you have a question? Miss Ruxana Vora, you have a question?
No,
Yes.
no.
Okay, your hand was raised. That's why. Okay. So I think we did cover questions, but I do want to give everybody a chance more to go ahead and ask any more questions you have. And there's a lot to talk about diet. We can have an entire session on diet if, if there is one that we can have. And the book that I recommended, The Tiny Habits, actually has a session and an entire thing about how to break the sugar habit, how you can break your habits that you want to break. So that's another um, very good thing to look at, and many other methods like that that can help you. Okay. I don't see any more questions. Okay, I don't see any more questions. I think I'm going to end this here, but if anything, I want everybody to take away a few important message or few important tips from this is talk about your mood and your feelings. Make sure that you seek help when you need. You could be having aches, pains, headaches, stomach issues, a lot of other problems that could be related to your mood. So do not ignore that and talk to your doctor about it. See if how they can help you. You don't always have to take the medications. Medications are a part of our treatment, but not the only treatment. Medications by themselves, they are not of that much benefit. If you want to get that 100% benefit, we always get it with therapy and medications. So it's not the only answer. Sometimes just therapy is the answer. You, if you have a stigma of being diagnosed, we're not no, nobody's going to just label you on one time. So if you just feel like we could say, okay, your screening is positive, just go see somebody, see if you need anything or not. I have some people who have no diagnosis, but yet they see a therapist and they feel a lot better, they feel more productive, they feel like all their problems are much better. So that is another thing. Change your diet, eat more vegetables, stop your processed foods as best as you can. Go low on that sugar, pick the natural sugars, and start building good new habits which would start very small and celebrate your small successes. As I said, one is better than a zero. Any movement is better than no movement. So if you were not doing anything for days and you just got up and went to the kitchen and started something, that is a movement. The next day, say, how can I improve this? Just you can talk to yourself and say, okay, maybe I'm just going to put a pan and make some tea. Just little smaller things that you can do for yourself. Self-care, meditation, social support. A lot of people ignore this, is get some friends, some colleagues, somebody who can be in this, your family, who can be in this with you, help you, talk and validate. And if you are somebody who's around people who are feeling low, empathize with them. Don't ignore them. Ask them to seek help. Take them, be with them, because sometimes they don't want to do it by themselves. So having a company is going to help them. If you take them places, if you be with them, they are going to feel better. So be that social support for somebody, and giving back, volunteering, helping other people, and just and when you see people like that, where you find somebody just crying, and we see that commonly if we go to a masjid and you're like somebody sitting and crying. No, you don't have to necessarily listen to their entire story, but just empathize with them, just give them a hug, just smile at them. And this is all a part of our deen, this is a part of our deen. Instead of being like, why are you shouting, why are you irritable, why are you this, why are you that, just empathize with the person, try to understand where they come from, and a lot can change with that. And we can, one step at a time, you can change things around you and within you. So with this, I'm going to end this, inshallah. And we will catch you in the next session. So subhanakallahumma wa bihamdik, ashhadu an la ilaha illa ant, astaghfiruka wa atubu ilaik. Until then, I'm going to end this session. If you have any other questions, there will be an email address that would be along with your link that you registered. So I'll be happy to answer your questions afterwards. There are, if you need help with counselors or to look at who is in the community, we have some resources, a website that can link and lead you to that. So if you have anything like that, just email us and we'll be happy to help you. Okay, Assalamualaikum.